One of the things about otolaryngology that I think is unique and special and rewarding, and I'm very privileged to do this, instances or patient interactions that has stayed with me as I think about how important it is to allow someone their ability to communicate. I've always been fascinated by the science of the voice and how it works. Hello, I'm Dr. H. Stephen Sims, the director of the Chicago Institute for Voice Care, and I just want to talk a little bit about how I came to this career in laryngology and performing arts medicine. I grew up in a musical family, a singing family, and I sang with my aunts and uncles and cousins. I probably began singing around age 4 or 5 in a children's choir, and then I started playing piano around age 6. I added trombone when I was 10 in the 5th grade, and then rounded all of that off with adding the bassoon when I was 14 years old. So I've always been interested in music production. But I think specifically I was interested in the human voice and how people made the sounds that they made and how that elicited certain responses from people. I thought that was just a wonderful phenomenon. And so I became very interested in how the system worked. When I was in high school, Annie Lennox had some voice trouble, and that was the first time I heard about a physician who would actually take care of a singer or of a voice. And for me, that really brought together things that were of interest to me. I've always been fascinated by the science of the voice and how it works. I've also been interested in how you help someone achieve a better voice. And so that particular career really brought together the things that interested me, and I always knew it would be rewarding work for me. As a singer, it is always rewarding for me to speak with singers and really understand what a deficit in the voice or a difficulty with singing notes that before something happened were very easy, how that affects the singer. And so I always enjoy my work helping singers get all of their range back, or helping with clarity, the sort of raspiness and hoarseness that can creep into a voice, being able to eliminate that and help restore the pure tones. But really one of the most memorable patients was someone who unfortunately suffered from breast cancer, and the evolution of that disease ended up involving the nerve that helps tell the vocal cords to move. And so she came in and her voice was weak and breathy. And what really struck me about this situation was that she worked in the legal system and was a judge. And the breathy voice was actually interpreted by people as weakness. And so in her own courtroom, people often spoke over her, and it made it more difficult for her to assert herself. And so we did a surgery to reposition her vocal cord called a thyroplasty, and we placed an implant sort of behind the vocal cord and moved it to the middle, and that allowed her vocal cords to close and re-strengthened her voice. And when she came back in for her post-operative visit, she just cried and was so happy that she was able to reassert herself, to feel empowered in her own courtroom, because she was able to stop people from speaking over her. She was able to interrupt them and tell them that she wasn't finished with what she had started to say. And I think that was really one of those instances or patient interactions that has stayed with me as I think about how important it is to allow someone their ability to communicate. One of the things about otolaryngology that I think is unique and special and rewarding, and I'm very privileged to do this, is we work with how people interpret and interact with the world. So the senses, what you hear, what you taste, what you smell, and then how you communicate. And it is very personal. So for me, it's always been rewarding to help anyone who is having an issue with those things. For me, more communicative abilities and the ability to speak and project and translate the ideas in your head into something other people can hear. But the entire specialty is very rewarding in terms of how we help people live better lives by how they interact with the environment around them.